Hello guys, so now we shall be discussing regarding the muscles of mastication. Okay, so what are the different muscles of mastication which we have got? Muscles of mastication. Okay, so what are the different kinds of muscles of mastication we have got? First of all, before we discuss these muscles of mastication, you need to understand one thing, that all these muscles of mastication are acting on which joint? That is a temporomandibular joint, right? So this is the temporal region, this is the mandible. So here when you are opening the mouth or closing it, right, in this way, so you see the movement here. So this joint is called as temporomandibular joint. So all the muscles of mastications are responsible or are associated with this temporomandibular joint. They control this temporomandibular joint so that you are able to chew, right? So having a joint is not just enough, right? You need to have some power to the mandible to chew the food, right, or the solid food. So for that reason you need the muscles of mastication. So all these muscles of mastication are associated with the movements of which joint? Temporomandibular joint. Are associated with the movements of temporomandibular joint. Okay, so they are all associated with the movements of which joint? That is your temporomandibular joint. Now let us say what are the different muscles of mastication we have got. So the first important, there are basically 4 important muscles of mastication which we have got. What are these 4 important muscles of mastication? First important thing is the masseter muscle. First important muscle is the masseter muscle. After that, the next important muscle we have got is the temporalis muscle. The next important muscle is the temporalis muscle. Third and fourth muscle are your pterygoid muscles. One muscle is called as medial pterygoid and which is located laterally is called lateral pterygoid. Medial pterygoid muscle, and next we have got is the lateral pterygoid muscle. Okay. So what are the different kinds of muscles we have got? Masseter muscle, temporalis, medial pterygoid as well as the lateral pterygoid muscle. Now important thing is that from where are all these muscles developed? All these muscles are developed from your pharyngeal arch. Okay. So all these muscles are developed from your pharyngeal arch. All these muscles are developed from your pharyngeal arch. Okay, so all these muscles are developed from your pharyngeal arch. Now next important thing is that, okay, all these muscles are developed from the pharyngeal arch. Now all these muscles are innervated by which nerve? They are innervated by the mandibular nerve. Okay, so they are innervated by mandibular branch of trigeminal nerve. Mandibular branch of trigeminal nerve. Okay, so this is the important thing you need to know. So they are innervated by the mandibular branch of your trigeminal nerve. Clear? Mandibular branch of your trigeminal nerve. So these are all developed from which arch? They are all developed from the pharyngeal arch and they are innervated by the mandibular branch of your trigeminal nerve. Now let us see how these muscles are present on the mandible over here, right? So let us say this is your cut section of your mandible. This is your mandible over here, and let us say that these are the teeth. Now in this particular picture over here, so let me draw some few muscles. See, one muscle that is located over here. You see this muscle, right? So this muscle which is located over here like this, right? So this muscle over here is called as your masseter muscle, right? Inside to the masseter muscle, here exactly you have got another group of muscle. Okay, so this muscle which you can see over here, is what is called as a medial pterygoid muscle. Okay, so this muscle over here is called as medial pterygoid, and this muscle over here on the surface of the mandible, see here, this muscle which you can see over here, right, which you can palpate, this is called as your masseter muscle, like this. Okay. Next important thing is that let us say that you have got a fan shaped like muscle like this, in this way. Okay, so this fan shaped like muscle which you can see over here, this muscle is entering into your temporal region. All of you know that this particular region, whatever I am drawing here, is your temporal region. So this is your temporal region. So if you can look at this thing over here, see, exactly this is your temporal region. So there is a muscle like this, like a fan on the temporal region here. Okay, this muscle on the temporal region over here is called as temporalis muscle. So basically this muscle which I am drawing right now, right, so this would be your temporalis muscle. After this temporalis muscle, the last muscle you have, one is medial pterygoid is done, the next muscle is lateral pterygoid. See, there is another muscle that is coming all the way like this. Let me rub this out. You see this muscle over here, right? So this muscle over here which you can see like this is what is called as your lateral pterygoid muscle. So one you have is called as a medial pterygoid and the other one you have is the lateral pterygoid. So this muscle over here is called as your lateral pterygoid muscle. So let us just label all these names and then let us look at the actions of each and every muscle. So this muscle over here is called as your masseter. This is called as your masseter muscle, and this one over here is called as your medial pterygoid muscle. Later on let us discuss each muscle in detail. Okay. Next, this muscle over here is called as your temporalis, and this one over here is called as your lateral pterygoid muscle. One is medial pterygoid, another one is your lateral pterygoid muscle. Okay. Now what we will do is that we will draw some arrows on these muscles. Okay. We will draw some arrows and later on I will discuss the action when I will discuss each and every muscle. When it comes to the masseter, I am going to draw one arrow onto the top, one arrow onto the front. Let me use another color. One arrow onto the top, one arrow onto the front. Okay. When I use medial pterygoid also the same, one arrow onto the top, one arrow onto the front. When it comes to the temporalis muscle, one arrow onto the top, one arrow onto the back. Okay. When it comes to the lateral pterygoid, one arrow front and one arrow down. Okay. So this is how you need to remember this. Okay. Now let us discuss about each and every muscle over here. The first muscle we have got is a masseter muscle. You see this muscle? This is called as your masseter muscle. And remember one thing, this masseter muscle is considered as the most powerful muscle of mastication. Most powerful muscle of mastication is called as your masseter muscle. And this masseter is having two parts. So there are two different parts of masseter muscle. What are those two different parts? One is called as a superficial part and the other one is called as a deep part. So you have got the superficial part and next you have got the deep part of your masseter muscle. Now in this picture itself you can see which is a deep layer, which is a superficial layer. The muscle which is long here, this is called the superficial. Behind that the muscle which is short is the deep muscle. See this muscle which is long, right? So this muscle is called as your superficial muscle. Behind the superficial muscle, whatever you have is a deep muscle. Okay. Let us see its origin and insertion. For example, in this particular picture, if I have to draw the superficial as well as the deep, this is how we will draw. So let us say this thing that you know that this entire bone is called as your zygomatic bone. Right. Now in this zygomatic bone, there are two important things. What are those two important things? In this zygomatic bone, whatever you see this front part of the zygomatic bone, you see this is called as the maxillary process of the zygomatic bone, and this part is called as a zygomatic arch. Okay, this is called as a maxillary process of the zygomatic bone, and this one is called as the zygomatic arch. So here if you have to look at the picture, you see this part over here is called as a maxillary process and this part over here is called as a zygomatic arch. Okay. Now let us see this thing. First important muscle out of superficial and deep is superficial. The superficial muscle originates from the maxillary process of the zygomatic bone. What is this? Maxillary process of the zygomatic bone. And coming to the second muscle, what is the second muscle? The deep one. Deep one originates from the zygomatic arch itself. Okay, deep one originates from the zygomatic arch itself. Now, this deep one comes down and attaches where it is attaching to your angle of your scapula. You see, this particular one is attaching to your angle of your, angle of your mandible. I am sorry, it is attaching to the angle of the mandible. And next, the top one, what is this top one called as the superficial one? The superficial one starts from the maxillary process of the zygomatic bone and it comes down all the way like this and it attaches again to the same point, that is the angle of the mandible. Okay, so this green one is on the top, that is why I called it as superficial, while the yellow one is on the bottom, so I called it as deep. But origin might be different, but the insertion is at a single point. What is this single point over here? That is this angle of your mandible. Okay, so let us just name all these things. So this particular part over here is called as a deep part, and this is called as your superficial part. So deep originates from where? Zygomatic arch, and this one originates from the mastoid process. The maxillary process. From the maxillary process. Maxillary process of what? Maxillary process of your zygomatic bone. Okay, so this is the complete description about your two muscles over here, that is two parts of the muscles. One is called as your masseter muscle and the other one is called the superficial part of the masseter and the deep part of the masseter muscle. Now if you look at the actions of this masseter muscle, just look at the actions over here. Now this masseter muscle, the main important action which it does is this one. What is this action here? This is called as a elevation of mandible, right? You see this masseter muscle, if it will contract, the mandible elevates. So if this is the mandible like this, you see, closing the mouth. Masseter is responsible for what? Closing the mouth. Why? It is responsible for elevation. And not only that, I can protrude the mandible anteriorly. If this is the mandible, look here, I can protrude the mandible anterior like this. See, if I am doing this action, this is called retraction of mandible. I am protruding now. This is called protrusion of mandible. Okay. So masseter muscle has got two actions over here. The main action is elevation of mandible. Elevation of mandible. So because of this elevation of mandible, what is going to happen? Closes the mouth. Elevation of mandible, which would lead to closing the mouth. Okay. So this is the first important muscle, that is masseter muscle. Now the second important muscle over here we'll discuss is the temporalis muscle. Okay. So from where does this temporalis muscle originate? Temporalis muscle originates from the temporalis fascia. And where it is attached? It is attached to the lateral surface of the skull. You see this particular fascia here, right? This particular fascia, whatever you can see, is called as your temporalis fascia. And where it is attached? This muscle is attached to the lateral surface of the skull. You see, it is getting attached to the lateral surface of the skull. Okay, so that is what is called as temporalis muscle. So the origin is temporal fascia. Okay, and next, where is it inserting? To the lateral aspect of the skull. Lateral aspect of the skull. Now one very important thing you need to know is that this particular fascia, whatever is there, this temporal fascia is the tough fascia, very tough fascia. Okay, so you need to know that this particular temporal fascia, okay, so this particular temporal fascia is a tough fascia. So when I call it as a tough fascia, what you need to understand here, is that whenever a patient is having damage to the tympanic membrane, So in that case of damage to the tympanic membrane, you need to repair the tympanic membrane, that is called as myringoplasty. So in order to repair the tympanic membrane, what you need to do, you need to put a new fascia, right? You use this fascia as a tympanic membrane over there. So that is the reason why we choose this particular temporal fascia for surgeries like myringoplasty. Okay, why? The reason is that because this fascia is a tough fascia. So that is why what we do is that we remove just a part of it. We harvest a part of it and put it as a tympanic membrane. So that surgery you call it as a myringoplasty. That one you call it as myringoplasty. Right. Now, if you look at the temporalis muscle, what are the actions of this? Where is the temporalis? This is the temporalis muscle. Now, if you look at the temporalis, what actions can you figure it out? One, I know that it is responsible for elevation of temporal muscle, I mean elevation of the mandible, right? And next, it is also moving back, right? It means, you see, this is the mandible like this. If I am moving back, this is how I move. You see? So, I am moving my mandible back, I am moving my mandible front, back, front, this action. If I am moving my mandible back, this is called as a retraction of the mandible. Okay, so two actions, one is elevation of the mandible, another one is retraction of the mandible. So two actions over here, right? So two actions, what are those two actions? One is called as elevation of mandible and the other one is called as a retraction of mandible. Elevation as well as the retraction of the mandible. So these are the two important actions. Okay, right. After these two muscles, the next muscle which we shall be discussing is the medial as well as the lateral pterygoid. So first let us discuss about the medial pterygoid. Medial pterygoid muscle. Now when it comes to the medial pterygoid muscle, let us look at the action here. See, this is the medial pterygoid muscle. Medial pterygoid muscle has got mainly two actions. One is protrusion, right? Another one is elevation. So out of these two, the main action is this one, elevation of your mandible, right? So masseter has also got the same function, right? Elevation of the mandible. So medial pterygoid main function is elevation of mandible. Elevation of mandible. Okay. Next, coming to the lateral pterygoid. Coming to the lateral pterygoid. So coming to the lateral pterygoid, what is the action over here? Right. What is the action over here? The action over here is that, let us look at the muscle over here. See, this is lateral pterygoid. Now in this lateral pterygoid, you see the mandible is moving forward or backward? It is moving forward. You see, there is a forward movement and there is depression of the mandible. It means opening the mouth like this. Opening the mouth, right? So that is called as depression of mandible, and forward movement of the mandible is called as protraction of mandible. So what are the actions? One is protraction, one is depression. Not only that, there is one more action also. It has got dual action. That is, if I can move my mandible side to side like this, you see, this side to side movement is also done by lateral pterygoid. So by looking at the arrows, we understood two important things, that this muscle is responsible for protraction and depression, right? Protraction and depression of what? Depression of mandible. Depression of mandible. And next important thing over here is side to side movement. Side to side movement of the mandible. So this is another important action over here, right? So let us look at the real pictures over here. You see these muscles over here, right? Now in these muscles we have got the numbers over here. What are those numbers? Muscle number 1, 2 and 3. So what is muscle number 1, muscle number 2 and muscle number 3? Muscle number 1 over here is called as a medial pterygoid muscle. Medial pterygoid muscle. Okay. So when I tell muscle number 2, what is muscle number 2 over here called as? Muscle number 2. Muscle number 2 and 3, just look at 2 and 3. What are these 2 and 3 are called as? If you remember the previous lecture, then you will understand it better. Infratemporal fossa. There I have explained the muscles that are associated with this infratemporal fossa. This muscle number 2 and 3, both of them are lateral pterygoid. Both of them are lateral pterygoid. Okay, this one is also lateral pterygoid. So both these muscles, both of them are lateral pterygoid. Now out of this both lateral pterygoid, one is called as a superior pterygoid, another one is called as inferior. Now tell me, out of 3 and 2, which is on the top? 3 is on the top. So this is called as a superior lateral pterygoid, and next one is called as a inferior lateral pterygoid. Superior as well as the inferior lateral pterygoid, right? So 3 important muscles over here. One is called as the superior lateral pterygoid, next is called as the inferior lateral pterygoid, and third is called as the medial pterygoid. So this is how the cadaveric images will be asked. Okay, right. And where is the temporalis muscle? If you can see over here, I am rubbing all this. You see the temporalis muscle like this. You see this? This muscle is called as your temporalis muscle, right? You see this center part is completely light. This is called as a temporalis fascia, which is the toughest fascia useful for harvesting in case of myringoplasty, which I told you, right? So these are the muscles over here. Clear? Right. So you can see this. What is this muscle over here? What is this muscle here? This muscle which you can see over here, this is called as your masseter muscle. Masseter muscle. Okay. Next, after masseter, what is this muscle again? You know this. This is your temporalis muscle. Temporalis muscle. Okay, so one is your masseter muscle and the other one is your temporalis muscle. Let us discuss all the muscles of mastication once again. So muscles of mastication are what are these muscles of mastication? All of them are associated with the movements of the temporomandibular joint. Okay. Now, what are the 4 important muscles of mastication which you have got? Masseter muscle, temporalis muscle, medial and lateral pterygoid muscle. Okay. Now, all of them are developed from where? They are developed from pharyngeal arch, and they have got only one nerve, that is mandibular branch of trigeminal nerve, right? So these are the muscles here. So masseter has got one action mainly, that is called as elevation of the mandible. Medial pterygoid also has got the same action, that is elevation of the mandible. When it comes to lateral pterygoid, there is protraction, which means forward movement, and there is depression, which means the downward movement of the mandible. Coming to the temporalis, there is elevation of mandible and there is a retraction of mandible. Retraction is back. Okay. So these are the things, and in masseter muscle, I told you that this is the most powerful muscle of mastication. It has got 2 parts. One is called as a superficial part, other one is called as a deep part. Okay. So from where does the superficial part originate? The superficial part originates from the maxillary process of what? Of the temporal bone. Where does the deep part originate from? From the zygomatic arch itself. But where are they inserting both of them? They are inserting to the angle of the mandible. Okay. Next is your temporalis muscle, and medial pterygoid and lateral pterygoid. So these are, and most important is side to side movement is done by lateral pterygoid. Okay. So these are some of the very important things which you need to know regarding the muscles of mastication. So thank you so much for watching my video. Goodbye.